Again, welcome to the simulation lab. There are some psych-specific things we need to talk about. You have all been to the lab before, so we will do a very brief reintroduction of the lab and brief orientation to the resources that are available here. Before we go any further, we want to reiterate our basic assumption at the lab, and that is that everyone here is intelligent, capable, cares about doing their best, and wants to improve. And I know you've heard this a few times, and I hope it's not merely just this hokey saying that we have, but really something that you can internalize, particularly when you're in a situation. Could be here in the lab, could be out in clinical. It's definitely going to be when you get your first nurse assignment and you're on your own in a year or so from now, that you remember, like, hey, I'm smart enough to figure this out. I'm capable. I'm going to do my best, and I'm always going to improve. So take this with you. We believe it about you. We want you to believe it about yourself. So the general layout of the day is going to look pretty similar to past experiences. There's a scenario, then you debrief, then you go to another scenario. However, the objectives for the day are a little more psych specific. We'll go into that. We will briefly run through the lab equipment and where stuff is, and then we'll just quickly do some reminders about rules of the lab. Some of the differences between psych simulation and more kind of med-surg type simulation. Number one, you might have a harder time building rapport with a patient with a serious mental illness. So the focus in the simulation day is more so on that. You will be asked to do mental health assessments in a more focused way than you would in another type of simulation setting. You may be asked to use anxiety scales, like the Hamilton Anxiety Scale, that should have been part of your ticket in. You'll be on the lookout for things like alcohol withdrawal and needing to know how to perform a CVOS score for those types of patients. And finally, you will need to be able to provide these patients, particularly because of their mental health conditions, a safe environment, both for the patient and for yourselves. With that last point there, I just want to throw out there before I forget to mention it. If, as in the past, you need to contact people, for instance, you've probably called doctors in the lab before, you may also call security if need be today by using the same phone. So moving on to where stuff is and kind of a brief equipment rundown. We're going to try to hit this in 2 minutes or less. Hopefully by now it kind of goes without saying that you're always going to have a surgical mask on when you're in the lab, and your eye protection whenever you're within 6 feet of another human. Hopefully also goes without saying we always, COVID or not, gel in and gel out of our patient care rooms. We are also asking, based on a health department recommendation, that no matter what you're doing, if you're within 6 feet of another individual, that you wear gloves for that procedure or that encounter. MChart. It's available on all the laptops in the lab. The login is on every laptop in the lab. Once you get logged in, you will select your patients based on the list of psych patients that you will see there. Vital signs. Attach the monitors. Touch the screen. If you need to retake a blood pressure, you need to touch the screen again. It doesn't have an automatic setting. The med dispense units, similarly to the MChart, they also have a logon and password on the machines. If you are in 101A or G, use the corresponding med dispense unit there. Similarly, 101C and E have a med dispense unit that's pretty close to their patient rooms. Use that machine. Always do your 3 med checks or 3 medication safety checks. If you need equipment, equipment is either in the Pyxis towers, which are open. You can just pull on the door to get what you need. Or if it's like a blanket or an extra pillow or something, they will be in the cabinets alongside near the nurse's station. When you need to make a phone call, simply pick up that black phone on the nurse's station desk, state your name, state what you're calling for. If you're talking to a provider, you need to use an S bar. When you enter a room and when you exit a room, you must always be on the lookout for safety issues. Beds in low position, side rails raised, call light within reach. That's mandatory for all of our simulations here. A couple of COVID-19 specific additions this year. We've already shortened up our scenarios and our debrief times to try to minimize the length of time, keep it under 15 minutes that we're in 6-foot radius of another human. That means if there's anything that can be done during your scenario, spread out across the room or maintaining distance, do that. We want to keep you as safe as possible. The spray alcohol, which is in bottles in every room, is used at the end of a sim to spray down anything that was touched, and the alcohol wipes are used on mannequins for cleaning after the simulation. This is a team effort. We can all do this. We definitely want to keep you safe while you're here in the lab. So that's about 2 minutes of rundown about where things are in the lab. Want to just issue some reminders about rules of the lab. Number 1, this is a safe learning environment. There's no judging. Mistakes are okay. We learn from them. What happens here stays here, which leads kind of right into the next kind of bullet point there. Don't tip off your friends. Okay, it's really, really easy to know what to do when you have foreknowledge of what's coming, but it's a lot more realistic if it is, as it is for you today, kind of a surprise. That is a better learning experience. So don't ruin it for others. Don't talk about what happens here outside of here. And finally, as you're gearing up towards graduation and moving on to your professional career, realize that this is an extremely high level learning opportunity for you. And as you go through your professional career, there'll be opportunities like it. You can use debriefing in your clinical setting. You can really take this type of experience and have a lot of value with it from your professional career. So please don't let your experiences just be a one-time thing that you forget. Realize that this is a high-level opportunity for you and something that you could really carry with you into your professional career.
At the end of your day, one of the most important things you can do for the lab is fill out our electronic survey. You will find a link to it in your ILSTU email. We compile the info you offer and discuss it at our monthly SimLab meetings, always looking for ways to improve your experience here.
Welcome again to your day. We will be back with you in just a few minutes and we'll get you divided into your groups so you can get started.